So I heard taking contraceptives will make you excessively wet during sex. Yeah.
No, those are myths and misconceptions. Again, remember what I said, the functionality of estrogen in the body, one of them is to be able to moisturize the vaginal canal. So the assumption that if you take contraceptive that you will become too wet, and let me use the colloquial language, ni kama umekula cabbage, hapana, that is not true. You know, cabbage has been attributed that if you take a lot of cabbage, you'll get wet. The reproductive system and the gastrointestinal system are miles apart, so they have no correlation whatsoever.
Thanks. So taking contraceptives makes the vagina ice cold during sex.
Yeah. There are certain contraceptives, particularly the injectable ones, that have been attributed to causing low libido. So what we attribute as coldness is actually a decrease in libido in the body. When you have such an experience, please visit your clinician and we are able to discuss other options which are available and which will not interfere with your sexual pleasure.
I heard that taking contraceptives can damage one's bladder.
No, taking contraceptives have no effect on your bladder. However, as a woman, remember your urethra is just 4 centimeters long, and 4 centimeters long is almost the length of my middle finger, meaning that you do not have the privilege like the men who have a longer urethra, which is internal plus the whole extent of the penis, to be able to withhold urine. So please don't withhold urine, because then you predispose yourself to urinary tract infections, which will now damage your bladder. But contraceptives have no correlation to do with the urinary bladder. Okay, this is what happens. So when during sexual pleasure, because the sphincters are tightened, right? And the tightening of the sphincter, the tightening of the anal sphincter, is the tightening of the vagina. The two important muscles along the vagina, bulbospongiosus, bulbocovenensis. You pull the pee, right? Because how do we hold the pee? If you do the Kegels, actually the Kegels, you're holding back. That's exactly what happens during sex at a lot of people. So the aftermath of sex is that we encourage you to actually go and release your bladder, because urine could actually be held, and sometimes because of the friction, the thrust, for those who either are using whatever object that you're using, be it a dildo, be it a penis, that is inserted, this is inserted sex, then what happens is that thrusting can actually either move some bacteria from your anal region, number one, or push back the urine so much such that if it stays for a long period of time, then you can actually get a urinary tract infection. So the predisposition, because of the nearness of the vagina to the anal canal. So a bit, and remember the anal canal has what we call E. coli, which is a common bacteria, and it is harmless when it's within certain regions, like the anal canal. But 1 or 2 bacteria can find their way during the thrusting and go all the way. And if you have urine, they find a culture media. And that is how it is that you get a urinary tract infection. That is how we encourage you. Can you please pee after having sex?
I heard when using P2 for the first time, there's always a 50-50 chance that you get pregnant.
So when you look at the instructions around taking P2, you're being told that you have to take it within the first 72 hours. The longer you wait, the higher your chances of getting pregnant. So immediately after sex, you have to take within the first 12 hours, and then you follow that through, and then the last. If you don't take within those hours, or if you take a bit later, the egg might have been released. If you and just to take care a bit of biology, the mechanism of action of P2 is that what it does, it thins out the uterus. Thinning out the uterus, meaning it reduces. One of the effects is reduction in blood supply, which also then makes the blastocyst, after the zygote has been formed, prevent it from attaching. Then that's what now grows into a placenta and into a baby, into a fetus. So that is a function of the P2. But if you delay in taking the P2, then the whole of that process might have already happened and you will be pregnant. So yes, you have to be very cautious around the timings around which you take P2 because of that danger.
At what point do you take the P2?
The sperms can stay in the vagina for up to 3 days, FYI. Not necessarily the vagina, the uterus actually, because the vagina is very toxic. The vagina kills anything that goes there that it doesn't want because of its pH, which is acidic. But the sperms that actually survive the vaginal canal and go into the uterus is a environment. They stay there up to 72 hours. Hence the reason why we tell you P2s within 72 hours, right? Because if you, for example, you are releasing an egg and one of them just swims up into the fallopian tube, that's it. However, when you are having unprotected sex, please take it immediately. Follow it within 24 hours, 12 hours, and 24 hours, like that.
Okay. So I heard that organized religion is against contraception.
I'm going to be very philosophical.
Do your thing.
Indeed, organized religion has been one of the pushbacks, opposition that has prevented and continues to prevent women, particularly because of how it is that they want to police women's body and how it is that they want to have to be prescriptive around what happens to the women's body. The Catholic Church, for example, has come out against contraceptives, and condoms is one of the contraceptives they have heavily come out against, amongst other hormonal-based contraceptives. That they do this is really heartbreaking, that they want to decide what happens to a woman's body. Remember, they're the same people who will not support access to safe abortion services, despite the circumstances around which the pregnancy occurred, including sexual violence, right? Including defilement, they will still not support. So whilst they push back against access to contraceptives, we always have to, as a medical doctor, I always have to do making reference to national instruments that exist within this country that then speak around access to family planning and contraceptives. We have an adolescent policy that allows for adolescents to be able to access reproductive services within safe environment, that allows women to access contraceptive services, and even speaks of certain contraceptives, particularly those ones which are surgical, around tubal ligation, and says the age, the cutoff, and all that. So even when the religion would actually come out, I will always make reference to what is WHO saying, what is our Ministry of Health saying, because then it speaks into what needs to be done and the investments that need to be put into. So, vasectomy, this is the counterpart for tubal ligation for women. Vasectomy is a process where the spermatic cord, the one that transports the sperms, is actually cut so as to prevent the sperms from moving into for men, the urethra has dual functionality, which is for urination and also for passage of the sperms. So what happens is a small surgical incision that we make on your loins, and then we are able to cut and then stitch off. There's a question around reversibility. In most of the time, the reversibility is hardly, it's actually up to 80-90% that you will not recanalize. However, we've seen in research that one or two people, let me not quantify the number, but a couple of people have had reversibility where the recanalization has happened despite surgery. May I also mention that vasectomy is not castration. Castration is actually removal of your bones, and castration is about testosterone, the hormone, which is produced within the manufacture of testosterone is producing the testes. The two of them are not correlated. One of them is actually a prevention of the sperm from passing. The other one is actually complete removal of the testes. And there are certain procedures where we remove the testes. For example, if you have testicular cancer, prostate cancer, those are areas where we are able to remove. But in terms of it being a contraceptive, it is not a contraceptive. So when you look at the sperms contains two types of fluids, right? Is what you call the precum, the fluid which is produced from the testes, and then there's the spermatozoa which come from the prostate gland. When we actually interfere with the spermatozoa, we do not interfere with the precum, which is the fluid that nourishes, usually comes with glucose, protects the sperm when it's swimming during intercourse into the vagina and all the way into the uterus. So that is something that you have to remember, that there is no interference around the fluid. You will come, but the cum will be empty. At 17, the bones of the women stop fusing. So is it the hip bone? Is it the femoral bone, the long bones, they stop fusing? At 21, for the men occurs. Now back to the question around the broadening of the hip. There are certain contraceptives that have been implicated to cause weight gain. For women, it's interesting how we gain weight. We never gain weight from up going down. Our weight usually comes from down, starts with our thighs, goes to our asses, and then comes to our abdomen. Unlike men, whose weight usually most of the deposition of fat usually occurs around the abdomen. That's why the people for Nyama Choma and Bia, we see you are the people who accumulate calories in your abdomen, then it goes down. So it's not an issue of broadening of the hips as much as it is an issue of deposition of fat, particularly in injectables.
I heard that contraceptives backfire when used often.
Contraceptives, when used any drug, and remember, even contraceptives are drugs, they are manufactured in a laboratory, they are synthetic. So that means if you don't consume them, they're not administered rather in the right way, in the right dose, they are bound to backfire. P2s, the most common one. Coitus interruptus followed, that is another one. That for coitus interruptus is now the I will pour outside, I will not pour inside the vagina. I mean, for those lies and more stories, they will backfire definitely. However, if you're an individual who takes daily oral contraceptive, which is combining estrogen and progesterone, do not miss to take your contraceptive, because if you do not miss to take your contraceptive, particularly for a long period of time, the probability of return to fertility is very high. And even if, for example, you took today, then you miss tomorrow, the day when you remember, please immediately take that day and make sure that you speak to your clinician about the changes that have occurred in terms of you adhering to the medication. Any drug, when it's not administered with the right dose, with the right frequency, will backfire, including contraceptives. Viagra, the magic blue pill, the bullet that takes all men and makes them crazy because they want to be Trojans in bed. Fantastic blue pill, excellent. However, the blue pill is not for everyone. The blue pill, if I prescribe for my patients who have erectile dysfunction. So the processes of erection, actually there is a process of erection. One, you are able to get an erection, and then you're able to maintain an erection. Two phases. So a lot of men, particularly those who, for example, those who have chronic diseases, have had maybe diabetes for a long period of time that has injured the blood vessels, are among the patients that we prescribe for Viagra. So what you do is that some of them can at least get an erection, but they cannot be able to sustain an erection. We give in quantified doses, in measured doses, because we are cognizant of the side effects of Viagra. And I'm sure you've heard of stories around of people collapsing and people doing other things. I shall not mention. This is not the forum for that, but just know that it is a dangerous drug. So there's a condition called priapism, which is basically when you have a sustained erection that does not end. And we've seen this particularly for young people who've taken Viagra. And do you know how we manage it? We literally have to use drugs, first sedate you and be able to, because the functionality of the erection process is actually blood accumulating in the tissues of the penis. So that blood has to come out. Very painful procedure, and a sustained erection in priapism is so painful. It is not something that you want to experience. Please do not self-prescribe on Viagra. It's also a drug that is a miracle drug that we use for children who are born in premature, because it helps in maturation of their lungs. It actually helps in reducing pressures within the lungs. So do not assume that this drug can just be used for pleasure when you want to. Let us give you the drug when need be. Also, if you're worried about your erection, remember that the first place to go to when you have erectile issues is the head. Psychosocial issues, psychological issues. Why is it that you can't sustain or you can't have an erection before you run very fast to swallow a pill? When we are able to tackle that, then we can be able, after doing other tests, and we can tell you indeed you can be able to take Viagra. You're a patient who needs to take Viagra after we've sorted all those things. But 60-70% of the time, it's actually a psychological issue that needs to be addressed if you're having erectile issues.
I heard a child can be born with a coil implanted in the leg, causing disability.
No. If you look at fetuses in utero, they are covered by membranes. The biggest of those membranes that usually stays until childbirth is the amniotic membrane. IUD is actually inside, like a teat, inserted like this inside the cervix. So there is no way that it will enter. In fact, if it enters into the amniotic sac, what it does, it will cause damage to the amniotic sac. So there are other reasons why newborns are born with either a limb deformity, for example, or an amputation. There's a condition we call the Burns syndrome, which can be explained by other things but the coil. So it doesn't, that is a myth, and it's an interesting one because it keeps us smiling and laughing about it. And it reminds us also the importance of ensuring that you're on birth control if you're active sexually. So men also have orgasms. There are a lot of assumptions around that when you have an ejaculation, that is assumed to be an orgasm. That is not an orgasm. It is part of an orgasm. It's part of the process of getting an orgasm. When an individual has an orgasm, there's release of happy hormones, the endorphins, the oxytocins from our bodies, and some people will have abnormal jerk movements. It's like they're almost converting in a small way, or they have eye rolling, or they go into this tranceness. Yeah, a lot of men actually don't know about that tranceness. It's just about trusting and coming. That is not an orgasm. It's a general question around virginity, and basically virginity is for women is an existing of a hymen, and a loss of this hymen does not mean promiscuity, does not mean looseness. These are the street languages that are used, and there's a lot of unfortunate attention to the hymen that is unnecessary. It is unnecessary because what it does, it commodifies the woman's sexual organ, reproductive organ. And when it does this, there's a worthless that is put in it, that if somebody loses their virginity, then it degrades them, or it removes, it cheapens them. You can lose your hymen even when riding a bicycle. You lose your hymen when skating. But you can also lose your hymen when you have penetrative sex. And penetrative sex can either be through use of a penis or an object like a vibrator. So I come from a place where I challenge how we have over-glorified virginity, because it actually also places a lot of, we labor so much on being able to protect it and put worth to it, while there are other multiple matters that we can be able to discuss around sexual pleasure. And virginity has no correlation with pleasure. In fact, the breaking of a virginity, because it's part of the introitus, the opening of the vaginal canal, is very uncomfortable, right? So, and it has nothing completely to do with our pleasure, how we see our pleasure, but it's actually a construct from the society, from a cultural perspective, around the worthiness of a woman. A woman is not her hymen. A woman's worth cannot be put on her hymen. A man